Hello, I'm Joel Langford. I'm a certified BodyTalk practitioner. I'm also a Parama BodyTalk practitioner. And I'd like to talk today about the relationship between standard medical therapy and supportive or complementary sorts of medicine like BodyTalk. Now, one of the things that you may not know about me is I spent my entire career in standard medical systems. I was a hospital administrator for 35 years. And I think that our medical system is sensational. You're not going to hear from me that there's something really fundamentally evil and toxic about the system. We have to understand what it's good for and what it doesn't do very well. So as an administrator, I paid attention. I noticed the things that we were really good at, and I also noticed the things that we weren't very effective with. The things that standard medical therapy didn't seem to really be able to help substantially included chronic pain, depression and anxiety, asthma, gastrointestinal problems. Many of the digestive disorders that we have right now are a problem. Diabetes, heart disease seems to just march on. It's the progression of these diseases until they make their acute phase, at which point in time our standard medical therapy is pretty sensational, that caused me to scratch my head and wonder, what can we do to keep these diseases from developing so that we don't have these medical emergencies? I want you to understand that I will never ask you to cease your standard medical therapy. It's tremendously important, and it's important that you have a skilled and interested physician working with you to safeguard your health. However, there are other things that you can do to stay healthy, such as drinking enough water, getting appropriate exercise, getting plenty of sleep, eating healthful foods, not exposing yourself to toxins like alcohol or tobacco, right? We know all of these things. BodyTalk is a complement to regular medical therapy. It does not interfere with it. What it really does is it takes all of the systems that are broken as far as the programming about how do we go about doing our business and whether or not we communicate with other things, and we rehook all of that stuff up. You may notice that frequently when you receive standard medical therapy, things don't work. That doesn't mean the therapy isn't working. That means that your body is not recognizing it and using what it has been given. So when you think about problems that have become chronic, please consider adding BodyTalk to your regular health armamentarium, if you would. Think about the things that are not happening in the background, and if I had a little help with that, perhaps it would all start to straighten itself out. If you find yourself in this situation, I encourage you to give me a call and try out BodyTalk. I can be reached at 406-529-2190. I'm hoping to hear from you soon and help you on your way to better health.